We are back with eye doctor Rachel Wruble. She's taking your questions until about 6 o'clock. You can see the text number there on the bottom of your screen. All right, this person is asking, what are the best eye drops for contact lens wearers?
Okay, good question there. So there are, again, so many eye drops over the counter. It's really important to know what kind of contact you're wearing. There's soft, there's hard, and to make sure you have an eye drop specifically made for contact lenses. And it'll say it on the box for contacts. If you're a hard contact lens wearer with RGPs or sclerals, you definitely want to make sure you have a drop that is compatible with those lenses, and it should say it on the box there. But really important to use a drop that is made for contact lenses, otherwise you could create a film or cause damage to that lens.
Okay, so make sure you are reading the small print on those boxes. All right, this next question is, what relieves an eye sty?
Eye styes form when our oil glands get blocked up. So we have about 20 to 30 oil glands along your lower and upper eyelid margin there. And they can get blocked from multiple causes, like sunblocks or eye creams used around the eyes. Maybe we're not cleaning the eyelids well enough, or maybe we just have naturally oily skin. So when they get blocked up, they can get infected with bacteria, and all of a sudden you've got this big red, painful, tender bump that forms that we call a sty. So heat is a really good thing to use. Using like a hot compress that you can heat up in the microwave, putting it on the eye, and then afterward massaging that area. If you're not finding any relief from that, it's really important to talk with your eye care professional, because you may need like oral antibiotics, or you may need that opened up so it can be drained.
Okay. This person's asking, can wearing cheater eyeglasses instead of getting a prescription do more harm than good?
You go to the drugstore, and I've seen people do this. They go and they take these over-the-counter readers, they put them on, and they're seeing, is this the power I need? Well, it's really important to know what is the prescription of your eye, because if you're putting something on that's too strong for your eye or not strong enough, you could be creating eye strain for yourself. And then you want to think about, are your eyes the same in each eye? Most of us, our eyes are a little bit different from one another. So really important to have that comprehensive eye exam to determine what your refraction or your prescription is, to make sure you are wearing the correct glasses.
So does that mean you could go to the eye doctor, and if you just have like a slight thing, like you need that 1 point or 1.5, that they would tell you that, and then you could use the 1.5s? Or do you recommend that it should just be a prescription eyeglass?
Well, there are differences. So over-the-counter glasses usually are made of like a plastic lens. Prescription, you can get lenses that have scratch-resistant coating, anti-glare or blue light filters, which would be great for like screen time, looking at your cell phone and computers. And we know that it's made correctly and fits you well. So there are differences between over-the-counter reading glasses and prescription.
Okay. This person is asking, how can you relieve eye inflammation?
So it's important to know where the eye inflammation is coming from. We have patients that come in and we find that they have dry eye. We have other patients that come in that have autoimmune conditions creating the inflammation in their eyes. And they can all be treated differently. So it's important to find out what the diagnosis is. And with inflammation in the eyes, we may recommend or prescribe things like steroid drops in the eyes or anti-inflammatory drops to help alleviate the condition.
Mm-hmm. All right, this one says, how often should you get an eye exam?
So for adults over the age of 40, we should have an eye exam every single year. For kids, I recommend their first eye exam between 6 and 12 months old, and that's recommended by the American Optometric Association. And then you want to have eye exams for those kids at 3 years old and 5 years old, and then yearly after that, making sure that their eye health is staying where it needs to be, and that the prescription or vision is on par with where they should be.
All right, so if you're in that 18 to 45-ish, you can get it done just when you think you need it, or every 5 years, or?
I would recommend every year. Your eye doctor may say, hey, you were golden for 2 years. You just want to make sure that there's no underlying conditions that they detect that they want to monitor yearly.
Okay, great. And now my question is, how do you even give an eye exam to a 6-month-old? How do you even know that?
Yes. So honestly, a 6-month-old gets more done to their eyes than an adult does. We have a whole slew of devices that we can scope their eyes using lights and different filters in their eyes, and we have different instruments that we can detect Are their eyes aligned? Are they developing properly? We dilate 6-month-old eyes, looking at the retina, making sure that they're developing as they should.
Interesting. Okay. All right. We've got one more segment coming up. We're going to take a quick break. You can continue to text your questions there.